And welcome to Chentex Multimedia's live stream on this 31st day of March, the last day of March. Yes, and we were talking about many things to have been changed by now, but nevertheless, the way things are going, we all need to do is do our best, keep up with whatever we can do. Well, right now, this segment is a very special segment just on news in brief, and later on, we will have the real estate updates. Yes, unfortunately, it is time to separate. It is time to separate the news in brief with the specialist program. So, we will advise you of all the new timings as we have the real estate update, we have the travel updates, we have the migration, Kasafar and all those. So the specialist program will be standalone programs on their own, including Aapka Sehat, which is by the Indian Medical Association. So all those programs will now be standalone apart from the news in brief and the news updates. So, there will be two different and distinct segments. So starting from today. So this is news in brief. At 10 a.m. we will have the real estate update with Usha Chandra, and at 5 p.m. we'll do a full recap of the day and what's happening, especially in these times on this day 2 of the lockdown here in Brisbane. But first of all, let's take a very quick look at what's happening with the weather for today. With that, let's welcome to Dilraj.
Good morning everyone. Weather forecast for the rest of today is maximum 25 degree. Brisbane area is partly cloudy with medium chances of showers from late this morning. Wind southerly 15 to 25 km per hour, turning southeasterly 20 to 30 km per hour in the middle of the day and then becoming light in the evening. Fire danger is low to moderate. Sun protection is recommended till 3 p.m. and UV index is predicted to reach 8, that is very high. Till tomorrow, stay safe and enjoy the rest of your day.
And thank you very much. Dilraj, for that update. And yes, please do stay safe because it is very, very important. Well, right now, looking at some of the things that's happening, don't forget that the domestic travel requirements as well are in place. So check your states, check whether you can travel or, what you can do, whether you are traveling within the state, you're traveling outside the state. There are, quarantine requirements that will need to be met as well. So, it is very important that you keep up to date. And towards the end of the day, we will bring to you a full update, a full recap of what's happening today. The Premier's live will be coming on soon as well. We will bring to you that in the end of the day in the recap as well. But right now, for now, we know that the outbreak is still escalating.
Mission is confirmed.
Everyone's worried, but the good news is that so far, so good in terms they are linked.
Queensland recorded 8 locally acquired cases overnight.
We've had a lot of people now out in the community infectious. So that's why we need this 3-day lockdown to get on top of all of the contacts.
I'm today declaring Greater Brisbane area a COVID-19 hotspot.
Authorities have identified 2 distinct clusters, both linked to the same Brisbane hospital and strains of the highly contagious UK variant. The first stems from early March, when a doctor at the Princess Alexandra Hospital was infected by a hotel quarantine guest. That cluster stands at 8 and includes a landscaper on Brisbane's north side identified last week. 2 more cases are suspected to be related. A second cluster involves a nurse and her sister who have the same genome sequencing as a returned traveller. This cluster has grown to 8, with 5 new cases today. The nurse and her sister attended a hens party at Byron Bay last week, where 5 other people have now tested positive. Among them, a male entertainer who also works as a tradie on the Gold Coast. He also visited an aged care facility as a contractor.
Every resident in that aged care facility has already been vaccinated, had their first dose.
The focus is on the hospital and how the nurse caught the virus. She's now the second unvaccinated public hospital frontline healthcare worker to be infected there this month. Authorities are defending the pace of the vaccine rollout.
Already 41,000 of our frontline health workers and people looking after hotel quarantine have been vaccinated, which is around 89%.
But from tomorrow,
Watch for symptoms, go get a test. That is absolutely critical that we do that over the next 24 hours. So very encouraging news today. Thank you, Queensland, and I'll hand over to Dr. Young.
So very encouraging news overnight, and the most encouraging news from my point of view is that 33,000 tests were done, because we can only find cases of transmission in the community if people get tested. So I thank every single one of the people who came forward yesterday and got themselves tested. That has been critical. So we had 3 new cases overnight. One was a case acquired overseas in India and diagnosed in hotel quarantine, so will be admitted to hospital. The other 2 were locally acquired cases related to our second cluster. So I already have the genome sequence back for one of those 2 cases, and is exactly the same as the genome sequences for that second cluster related to the nurse and her friends who were in that party who went down to Byron Bay. So that's a linked case. We're now working through whether this second nurse in that cluster acquired it on the ward. She does work on that ward, and she was tested as part of the asymptomatic screening testing process for that ward and was found to be positive. She has since developed some symptoms, but she was part of that testing. So we just need to work out how she got it on that ward. She had been vaccinated prior to working that shift. So we're just working through all of that at the moment, but that's very good news. So we now have 11 people in that cluster. Now, the first cluster, remember yesterday I spoke about 2 cases that we're investigating who we thought could be part of that cluster because of the epidemiological links and some initial testing. They've now been confirmed as not positive. They're not cases, which means we now have 8 in that cluster, that first cluster related to the doctor who acquired the infection at the PA hospital. So those 2 clusters look like that they've all been worked through. All of those cases are linked, and we do not have any other cases out in the community anywhere in Queensland that are unlinked. So we do have some people admitted to hospitals, but they're part of that second cluster. So we do have an individual admitted to the Toowoomba Hospital and another to the Bundaberg Hospital. Both of those hospitals have managed COVID positive cases before, and they are managing those too. And because we got them so quickly due to that very fast action by that first nurse in that second cluster, we're not concerned that there's been any significant risk to the community. Having said that, these viruses are just so contagious. Both clusters are based on the B117 variant, which we know is very, very contagious. So please, anyone in Queensland, as happened yesterday, anyone with any symptoms, come forward and get tested immediately. Don't think it's because you've got kids who've been to childcare and they've had the virus that's circulating in childcare. Ignore any of that. Just if you've got any symptoms, please just come and get tested. And thank you to everyone for your patience in coming forward. This is a big load on the health system, but the health system will manage it and will test everyone who comes forward. That's really, really critical. But this is encouraging news overnight, and it's encouraging because people have come forward and got tested, and also people have followed all of the instructions. Here today, I can see, I think everyone, except us two, with masks on. That is fantastic. We need to continue that throughout the state, remembering that indoors is the most critical place to wear masks. Then going back to the seated drinking and eating so that you don't mingle around. That is so important. Limiting the number of people in a household to 30. That is so important for that area outside of Brisbane that isn't in the lockdown at the moment. Doing those things and protecting our most vulnerable. We've not quite got there yet with the vaccine for our most vulnerable. So that's really being rolled out now. So we do have to protect our disability accommodation, our aged care accommodation, our prisons and our hospitals, because that's where we know our most vulnerable people are.
Look,
so thank
before
you.
Go, and again I'm confused, I'm sorry. There were two cases of community transmission of life. One was a nurse who was in the Byron Bay, the other is still tracking birds.
No, sorry. Thank you. You're always very good at picking things up. So the first case is a nurse who's acquired it from that gentleman from India at the PA, and I have confirmation of that because I have the genome sequence. They did that very rapidly. Then the second case lives in the same household as that nurse. So it's household transmission, and we know that household transmission is our highest risk at the start of any outbreak. No, it's this second nurse. I don't have a genome sequence yet for that second person, so this is someone who lives in the same household as the second nurse. I don't have their gene, but I'm sure it'll be the same.
They're the two overnight cases.
They're the two overnight cases.
Somebody in Toowoomba and Bundaberg.
Yep, so they are the part of that cluster of 9 that I told people about yesterday related to the man from India. So you have the man from India who was admitted to the PA hospital. Right, there's been a transmission event to one nurse there who then went to Byron Bay and had a party in Byron Bay, and all of those people who are at that party, of course, have been tested. There were 10 of them, 6 of them are positive, and of those positives, one has been admitted to Toowoomba Hospital and the other to Bundaberg Hospital.
Those two were amongst yesterday's.
Yes. There's nothing new there. I'm just clarifying where these people are.
How many are on the Gold Coast?
And we've got 2 on the Gold Coast at the moment.
And whereabouts are they?
In the Gold Coast University Hospital.
And when was the nurse vaccinated?
On the 19th of March.
And how long does it take to be effective?
Remembering she's only had the first dose, so it usually takes a week after your first dose before you get a significant degree of immunity. Then you need to have a second dose of the Pfizer vaccine 3 weeks later, and it takes another week after that. If it's the AstraZeneca, you need to get that second dose 12 weeks after the first dose, and it takes another week after that. So she hadn't had a chance yet to have full immunity.
You said things looking encouraging.
Yes.
How are these still looking now?
Encouraging, but we have to wait, right? So this is only one day of encouraging results. We need to get more results from today, so it is absolutely extremely important that anyone with any symptoms gets tested. So if there's any other chains of transmission, we pick them up immediately. Then we'll get those results tomorrow morning and we'll be able to then make a decision.
Do you know the first nurse, do you know how she caught the virus in the first place? Like how is it getting out?
No, we know she did not look after that patient, but we know she's got it somehow from that patient because the genome sequence is an exact match with no SNPs difference. So we know it has got from that patient to her, but she wasn't directly caring for that patient. She didn't have direct interaction, which means that there is most likely some environmental contamination or some aerosolization of the virus when the person was admitted, because remember the person was admitted at 8:30 p.m. into that ward and that nurse came on shift at 10 p.m. So that's why that ward has been closed. No one is going in or out of that ward. Everyone who is in there has been moved out and there's been a very thorough clean being done of that ward.
You mentioned that nurse was infected by that.
Their genome sequence is exactly the same, so...
That one returned travel after infected by
Yes.
So at any stage were there COVID patients in Ward 5D and non-COVID patients at any time?
This is their infectious diseases ward, so they're all separate rooms, so they're all managed separately in that ward. They're all wearing...
Gentlemen, there you are. It is good news and encouraging news that the number of cases have dropped. But as Dr. Jeanette Young has said, and just before that, the Premier had also mentioned that we'll need to wait till tomorrow to find out exactly what's happening. But it is good news that it is not escalating and that the numbers have actually dropped and the tracing is going ahead as per plan. And of course, the vaccination is a little bit away. Well, to our finishing off in this segment, let's join our Prime Minister and looking at what's happening in the Parliament and all these allegations and all this things that have just surfaced. It is quite disturbing, actually, looking at what's happening, the behaviour of our MPs and others. So the Scott Morrison promises a more female-friendly environment in the Parliament.
A day of contrasts, albeit both in the online world. A new ministry sworn in remotely as the government looks for a female-powered reset.
So help me God.
And the ALP's national conference via Zoom. The opposition sensing a resurgence.
The next Prime Minister of Australia, Anthony Albanese.
The Labor leader comparing the post-COVID economic task to the national reconstruction effort after World War II, pitching himself as the modern-day Ben Chifley.
Victory over the pandemic followed by victory for those whose sacrifices made it possible.
With piped-in applause and careful choreography, the ALP conference has been designed to project a readiness for government on the day the incumbents were recycling or rehabilitating ministers of the Crown.
One more scandal, one more backbench troll sent off to study how to impersonate being a human being.
Undoubtedly with someone in mind, Liberal MP Andrew Laming on leave, having empathy training after harassing female constituents and a political opponent online.
I can assure you I am not defending Andrew Laming at all because I don't find his conduct acceptable.
Karen Andrews, the new Home Affairs Minister and part of a new Cabinet task force, scrambled by Scott Morrison to ensure government policies are female-friendly.
To demonstrate to the Australian public that we do understand the significant issues that women face.
We hope that they succeed because if they succeed, then that makes a difference for all Australian women.
Australia's successful handling of the pandemic appeared to make its political leaders unbeatable. We saw that most recently in the WA election. But federally, Liberals are alarmed that incumbency is no longer the advantage it once was for Scott Morrison. The mishandling of rape allegations threatening to outweigh credit given to the PM for his stewardship of the COVID crisis. Andrew Probyn, ABC.
Australian Indian Radio, and ladies and gentlemen, that's about all we have for you in this morning bulletin, in News in Brief. And don't forget, at 10 a.m. we have the real estate update with Usa Chandra, and at 5 p.m. we'll be doing a recap of the day and looking at how things are progressing. As we know, people are eagerly awaiting of what they can and what they can't do over the coming Easter, because everyone's been really tired of everything, and we're really looking forward to this small break. And of course, Easter is the most looked forward, beginning part of the year break. But anyway, right now it's a goodbye from this segment. We'll see you back at 10 a.m. with the real estate update with Usa Chandra. As I said before, it is now time to separate the specialist program with the news segment so that they can be presented on their own. So we have the real estate update with Usa Chandra, Aapki Sehat with the IMA Brisbane branch, and of course we have the migration super, and tomorrow we'll have the travel updates which everyone look forward to with Tanvi Goyal of Oz India Travel. So all of the specialist program will now be separated from the main segment of the news in brief and the daily updates. So ladies and gentlemen, you've been listening to Australian Indian Radio. Until the next segment, it's goodbye from me.